Welcome to another program of Act Two and You. My name is Laura McReynolds, and I'm so glad you've chosen to join us this Sunday morning. Hope everything is finding you and your loved ones healthy and safe. I am here today with a very special guest. Very excited to have with us Dr. Avi Weisfogel. He is the founder of the International Academy of Sleep. Is that correct, Avi?
International Academy of Sleep.
Okay.
That is our company, and thank you so much for having me on today, Laura.
Well, I'm so glad you're here. I think we have a really important topic that is important under just everyday circumstances because we're going to be talking a lot about sleep apnea. But given what's going on in the world today, I hope our listening audience really tunes in and understands how important this could be given what's going on in our current climate with COVID-19. So, Doctor, first of all, I just wanted to ask you, we're going to be talking about sleep apnea, and it's obviously a huge problem. I don't know the statistics, but I bet you do. So just let's just kind of dive into that topic without any, regard to COVID-19 and what's going on, but just sleep apnea in general. If you could kind of dive into that, and I might have a few questions.
Yeah. You got it. So sleep apnea, it is one of, if not the most undiagnosed diseases that is out there right now. So sleep apnea, if I want to give you a layman definition for it, obstructive sleep apnea, we can break it down into three little words. Obstructive, meaning there's something blocking. Sleep happens while you're sleeping. And an apnea is a full stoppage of breath, or at least a partial stoppage of breath for 10 seconds or more. And this is a cycle that goes on throughout the night while you're supposed to be sleeping. Now, we as human beings are made to have our bodies rest and recover during sleep. Like it or not, we don't sleep, we don't function. People can go back and forth on the amount of sleep. But what we talk about with obstructive sleep apnea is, hey, what is going on while your body is supposed to be resting and recovering? So there's something that's blocking your airway while you're sleeping that stops you from breathing. The way the body works is you stop breathing, it's going to want to start breathing again. Now, all of a sudden, your body will wake you up. You won't know it, but it'll be a signal to your brain that sounds something like this, and excuse the noise, but you might have heard this from your bed partner at some point, something like this, right? A little snort, or a snore that's loud. It's a signal to your brain that says, wake up, we're not breathing here. You got to start breathing again. And this cycle goes on throughout the night. While this is happening, instead of your body recovering, it does what I call the same thing that happens if you're out jogging and you decide to run straight up a hill. And you get to the top of the hill and you're bent over trying to catch your breath and you're breathing heavy and your heart's beating real fast. The reason that happens is there's a lack of oxygen going to the organs, and so the heart is compensating to catch up. So you're supposed to be resting and recovering, and your body's running uphill all night. It's only a matter of time before that starts to take effect and toll on your heart. Hence, obstructive sleep apnea is this big problem that unfortunately is 95% undiagnosed in this country. The numbers are staggering, somewhere in the neighborhood of 40 million undiagnosed patients.
Wow. So you mentioned that startling sounding snort, and I have personally heard it. My husband happens to have been diagnosed with sleep apnea, so I recognize exactly the sound you made.
So you're familiar.
I am. I think probably several spouses out there listening right now, male or female, because I think that's a misnomer, right? That we think it just affects men?
It absolutely is. So it does affect men slightly more than women. Men tend to snore a little bit more. In addition, men technically have larger necks, and neck size plays a role in this. Note that most of the science is new. The sleep specialty became a new thing in the 90s. So this is mostly newer science, but we're really starting to catch up and understand what's going on. So this does affect more men than women, but it's like 55-45, so it's not that big of a difference. This one is not that choosy. If you have an issue where you stop breathing, which can be due to a large tongue, could be due to a large neck, or even this thing called gravity, laying on your back and your tongue just drops right over that airway, that's enough to cause you to stop breathing.
Right. And other than that snort, are there some other kind of things that maybe a spouse would hear or somebody else would know about, or you would recognize in yourself to think, I wonder if I should have this looked at?
So common snoring, that's one of the things that leads right to it. Think of sleep apnea as a progression. There is never a person who goes to sleep one night and has no sleep apnea and the next night has a severe case. It's a progression that goes along with life. So when they talk about sleep apnea becoming worse with age, it's just because it's been undiagnosed all that time, sitting there festering.
Oh, that's fascinating.
It starts out with snoring. Yeah, it starts out with snoring. So if you're snoring, you are on the way. There are things you can do if you do snore to stop you from ever getting to the sleep apnea part of it.
So I think you're going to have some solutions for us, and that's where you were headed with that. One question I did want to ask before we go there is if there is something that tells us definitively. So you've already said the snoring. I don't know. I mean, I've heard before, like if people are really tired the next day and they think, gosh, I got a lot of sleep. Why am I tired? It's because they're racing uphill all night, as you described it. That startling kind of gasping snort sound. But if you have some of those things, is there a test that people should get?
So there is, and a lot of this will come from symptoms. Tired definitely is one of them. Another, you could look at your bed partners and they don't even look like they're breathing. It's something that I did see actually in college with my roommate. We thought it was pretty funny at the time. Here he is, this guy who just stops breathing. We would actually watch him in front of him, we'd throw things at him, he wouldn't be breathing. All of a sudden, that little snort would happen. I had no idea what a role that would end up playing in my life. But those types of things, being tired, snoring, waking up, feeling as if you're choking or gasping is something that we hear about all the time. So all these different things play a role. And then, of course, to find out whether, in fact, you do have sleep apnea, there is a test which is actually pretty simple. It could be done at your home. When I first got into this business 20 years ago, it was all done at sleep labs. So if you wanted to know whether or not you had sleep apnea or not, you'd have to go sleep in a bed at a lab, not the best circumstance to begin with, and you would literally be hooked up to 17 different leads stuck on different parts of your body. Go to sleep at 10, wake up at 5, where if you put me in that scenario, I probably would not have slept for 1 second.
I started to say,
night, so.
I don't know how anyone could get any sleep in that circumstance. Yeah.
Nowadays,
so you're saying now.
We're lucky. Yeah, nowadays we're lucky. It's a real simple, easy home device. It could be as simple as a watch or something that looks like a tennis visor, or probably the most common one we use, which is a little thing that goes on your finger, like a pulse oximeter, along with a little belt that goes around your chest to see how the breathing is going.
Okay. So I started the program by saying sleep apnea is a huge problem, seriously underdiagnosed, and obviously leads to serious health issues, much less just the stopping breathing right now, but progressive health issues. But right now, during this COVID-19 crisis, why are we talking about sleep apnea?
So it's more prevalent than ever in society. But right now, what are the things that we hear about with COVID-19? And I'm not talking about, hey, social distancing, stay away from people. I'm talking about the people at risk of dying, which are underlying conditions that have to do with your cardiovascular health, anything to do with your heart, respiratory, which is obviously breathing, and even diabetes, where those three things are the three that I keep reading about, where it says this person suffered from, and those are the people dying from COVID-19. These are the very things that we talk about every day in sleep apnea. So without COVID-19, we talk about, hey, if you don't get your sleep apnea taken care of, you're going to develop a heart condition, you're going to develop a respiratory condition, you could develop diabetes. These are all different things that come from not treating sleep apnea. And so I will tell you a quick one. My dad is a cardiologist. He's been practicing for years. He was and is a man of science. And when the idea of sleep apnea was brought up to him 20 years ago, he said, you know what, I think some of my cardiovascular patients may develop sleep apnea. When he started to study it and look into it and went to the point of becoming an actual sleep doctor, he has changed his tune to the point where he will tell you, my patients that have sleep apnea, their sleep apnea has caused their cardiovascular conditions to be worse.
Wow.
So it's not something where it's just, hey, maybe you have sleep apnea. If it's more, you are likely to develop cardiovascular and or respiratory conditions that need treating that could lead to death under normal times. And now more than ever, if you get COVID-19 and your body's fighting to stay alive as it is, the people that are dying are the ones with heart issues and respiratory conditions. And that's something that we hope could be avoided.
Right. Absolutely. So when you say we hope that we can avoid the sleep apnea and all the conditions that follow, really for probably most people, years of having had sleep apnea, is the treatment expensive?
So under normal conditions, this is something that's covered by insurance. We have to talk and be real about the world today. And the world today is different than the world was a month ago. COVID-19 has almost everybody at home. Unemployment rates are higher than ever. And insurance is changing. So I wouldn't say that the treatment is expensive because we're going to put it into perspective. But normally it's something that's covered by insurance. Okay. Nowadays, you may find a bit of a harder time finding a doctor or a dentist who can treat this and take insurance. But even if, I always use this line when I lecture, and I lecture on sleep apnea 3 or 4 times a month. What if you were to go into a grocery store and on the shelf was a year of life? What would you pay to have 1 year of life that you could cash in? The average years of life that you can actually add to your life, we're talking treated sleep apnea patients versus untreated sleep apnea, is a minimum of 8 years, all the way up to 20 years of life.
Wow.
So imagine going into the store, seeing 8 years of life for sale. What's the value on that?
What's it worth?
Priceless.
Absolutely.
You're talking about times with your loved ones, times where you can see your grandkids. These are the important parts of life. When you're sitting there and you get to the point of your death, you're on your deathbed, what would you give for even a day, let alone 8 years?
Absolutely. It's time for our first break. We're going to be right back with you. Thanks so much.
More Act 2 and You to come on News Talk 105.
Hi, I'm Sarah Ginnenbacher.
And I'm Jason Bedell, and we're both certified personal trainers at Advanced Wellness. If you're a baby boomer, born between 1946 and 1964, you're one of the largest, fastest growing populations in the world. There's over 80 million adults 55 and older, and 10,000 every day turn 65. And our passion at Advance is to inspire and motivate those baby boomers and seniors to live an active, vibrant, and healthy life.
Contact us at Advance Wellness, 222-6800, or find us on Facebook.
It's thoughtful and sensible to plan funeral arrangements in advance.
Your wishes will be carried out, the cost is secured, and there's no added stress on the family.
Plan a celebration in advance. It's a kind way to care for your family. Call us. We'll take care of the rest.
Hanson Spear Funeral Home, celebrating a life well lived.
See it clearly. See it here. Your good vision starts at Specs. Get a thorough eye exam from Dr. Dan Hayden and Dr. Danita Bacol-Cooley, optometrists. Choose from our awesome selection of eyewear for frames that are really you. Contacts? They're a specialty at Specs. Ask about the insurance we accept, too. It's the kind of vision care you want for your family. So call us, 224-SPECS. Specs. You'll like what you see.
All optometric services performed by a licensed optometrist.
Is retirement too big a number to wrap your mind around? Is the amount you'll need too big a mystery? Do you know where you stand today in order to figure out tomorrow? At Adams & McReynolds, we want to get to know you, not just your numbers. We believe with our team approach to guide you, financial planning will yield confidence, assurance, and a good night's sleep. Get your financial plans underway by calling us at 224-0420. Live more, worry less. That's Adams & McReynolds.
Looking for personalized, stress-free IT solutions for all your computer needs? Adams Fiber now offers area residents and businesses an expanded team of technology specialists to help with all of your computer needs called Adams Experts. You don't even need to be an Adams customer or have internet provided by Adams to use Adams Expert services. Plus, for your convenience, we make on-site visits. Call Adams Experts today for computer maintenance and repairs you can depend on.
News Talk 105 WGEM. What radio wants to be when it grows up. News Talk 105 WGEM FM. Quincy, Hannibal, Keokuk.
We now return to Act 2 and You, hosted by Adams and McReynolds.
This is the One Less Worry segment, and today I'm just going to do a quick thanks to our underwriters. Of course, we are always happy to have with us on air Advanced Physical Therapy. Kent and I are Adams and McReynolds retirement partners. The folks at the Blessing Health System, we always enjoy having on with us. Good Samaritan Home, the Trust Department at Mercantile Bank, Quincy Audiology, and Specs. So we encourage you to visit those providers when you can support them. We sure appreciate that from Act 2 and You. Today's program is sponsored by or brought to you by Serenity Sleep Solutions. They offer oral appliance therapy for patients who have been diagnosed with sleep apnea and or snoring. Their phone numbers, just real quick, want to tell you in Quincy, you can reach them at 214-7222. They're out on Broadway. And then in Keokuk, you can also reach them, area code 319-313-8953. It's serenitysleep.com. We're so happy to have them sponsor today's show, and look forward to hearing more from them. And if you need a copy of today's program because it's such important information, please feel free to reach out to us at Adams McReynolds, 217-224-0420. Thanks so much.
More Act 2 and You to come on News Talk 105.
For 90 years, Mercantile Trust Services has earned the trust and respect of our clients by providing accountability and expertise. Senior Trust Officers Joanne Wilmot, Dick Milgram, and myself, Randy McFarland, are unmatched in our knowledge and experience. And with the addition of Dan Cook and Ramona Schoonover, our team is stronger than ever. We're proud to faithfully serve relationships that span generations of families in the Quincy area. Trust, that's Mercantile.
At Good Samaritan Home of Quincy, they know the need for quality healthcare services has never been greater. For more than 60 years, Good Samaritan has provided secure Christian service to their residents, their families, and the greater community through compassionate charitable care and a warm family atmosphere. At Good Samaritan, they are especially suited to meet your particular needs with dignity and compassion. Visit Good Samaritan Home, where it just feels like home. Located at 2130 Harrison in Quincy.
When a restaurant sounds like this, when music sounds like this, it's time to reclaim your enjoyment of hearing. Quincy Audiology is the only Audigy certified practice in the region. We take the time to understand your hearing issues. With precise diagnostic testing, experience optimal clarity with a hearing solution tailored especially for you. From Quincy Audiology.
People have invited Blessing Home Care and Blessing Hospice into their homes for 30 years. And it's not just because we're great company. People choose Blessing for these vital home-based health services because Blessing is the region's homegrown healthcare leader with a reputation for quality and compassion 3 decades strong. If your doctor recommends home care or hospice care for you or a loved one, invite only the best into your home. Choose Blessing.
At WGEM, we track storms. And with the WGEM Storm Track Weather app, you can track storms too. See storms approach your area with our mobile weather radar. Customize your view to track the storm's path. Show lightning activity. Receive watches and warnings. Be prepared. Be connected. Download today the WGEM Storm Track Weather app from your weather authority.
We now return to Act 2 and You, hosted by Adams and McReynolds.
Welcome back to Act 2 and You. If you are just joining us, we've had a very interesting conversation during the first segment with Dr. Avi Weisfogel. He is the founder of the International Academy of Sleep. He lectures on sleep apnea. He has taught us so much during the first segment. And Doctor, welcome back again to the show.
Excited to continue. Thank you, Laura.
Absolutely. So we talked during the first segment about how seriously underdiagnosed sleep apnea is and some of the things that you look for in that and whatnot. Folks, if you're just tuning in and you'd like some of that information, please feel free to give us a shout at Adams McReynolds and we can get the whole show to you. But we're going to continue with the conversation with the doctor and we're going to find out, how I sort of was asking this as we were wrapping up, but really, how do you know if you've got enough signs or symptoms or something? How do you know that this is really something that you should be tested for?
So one thing you want to keep in mind is right now, COVID-19 is everything on people's minds. And the fear of death is real. I mean, 2% is a staggering amount of people. That's 2 out of every 100 people. And this is affecting almost everybody. There's a one-off. You know someone who knows someone. And it's scary. Now, if you are someone who has cardiovascular, any type of heart condition, any type of respiratory condition, or diabetes, this is absolutely something you want to get seen for or tested for, even if it's just something as simple as snoring. The main thing that people are dying from is a lack of oxygen. And when you do get tested for sleep apnea, we'll see exactly what your oxygen levels are. And if it's too low, we're going to come up with a way for your oxygen levels to be increased. Think of the shortage of ventilators. It's all about getting oxygen. And there are things that you can do right now to increase your levels of oxygen.
Do you have to see a specialist or is there other, I don't know, how does someone proceed?
So let's take it in today's day and age, because right now, listen, people don't want to go out of their house, let alone do anything.
Right.
Believe it or not, the best place to get treated for sleep apnea right now is going through a dentist who knows something about sleep apnea. This is an unprecedented time in sleep apnea. Normally, there's a whole process you go through to get tested. You're going to see one doctor, to see another, to see another. This is something where going to a dentist who knows sleep apnea, such as Serenity Sleep Solutions, which is right there in Quincy, Illinois, is a great place to start because you can get tested. And if you test positive, you can get treated with what is right now the only treatment people are talking about, which is an oral appliance made by your dentist, custom fit for your mouth to increase the amount of breathing you're doing while sleeping.
And 2 things that came out of that answer, Doctor. I think right now, and I could be mistaken about this, but I think right now there is some talk by experts that if you're a current CPAP patient, but you're not cleaning it properly, that's dangerous anyway, but it's extra dangerous at the moment.
Yeah, it goes past not cleaning it properly. It's very difficult to clean a CPAP. Now, listen, I'm going to tell you that I have been in the CPAP business for years, and we are not giving out CPAP at all right now because the risk of reinfection is too big. On a normal basis, if you had the flu, you would not sleep in the same room as someone if you had the flu because your saliva, respiratory droplets are going to be spread throughout. Now, more than ever, it's just a dangerous thing, and the risk of reinfection of yourself even is a big deal. So we are not recommending CPAP at this time. We are only recommending oral appliances, which has never happened in the history of sleep apnea. So right now, at this time, during this entire pandemic, this is our only option for treatment.
And how do these oral appliances prevent or decrease the episodes, or how do they work?
There's really 2 ways typically of treating sleep apnea. One way with the CPAP is forcing your airway open with pressure. We just talked about why we're not going to use that during this time. The other way is what happens naturally. Nobody with sleep apnea has a problem breathing while they're awake. It's only while sleeping. While you're asleep, your muscles don't work the same way. Your airway doesn't work the same way. You lay on your back and gravity takes over. What the oral appliance does is it mimics everything that happens during awake time. It'll keep your jaw in the proper position. It'll stop your tongue from dropping over the airway. It'll activate facial muscles, which help keep your airway open, all of which lead to increased oxygen going to the organs in your body.
It sounds almost as if we just kind of relax when we're asleep, which is what we're supposed to do.
That is the purpose, right? We want to relax, recover, and start a new day. And when you're running uphill, you wake up more tired than you did when you went to sleep.
Right, right. That's crazy. So how long does it take to get these appliances? I know we mentioned Sleep Serenity here in Quincy and in Keokuk if you're listening in the tri-state. And I'm not going to hold you to any amount of time, but is it just usually a matter of a couple of weeks or?
It is about a 2-week process. Now it's going to be probably even different than it would be on a normal time. This might be done by sending stuff directly to your house. There are times where it does pay to go out and see a specialist live. That's something that you have to talk over with the specialist. But it could be as simple as sending impression material to your house, somebody guiding you through this, either on the telephone or using a HIPAA-compliant platform on telemedicine.
I just started to say this is one of those places we can use telemedicine. That's amazing.
Telemedicine is everything now. I've been talking about it for years as the future, and it is 100% the present right now. You know, we work with specialists all over the country, and maybe 10% of them take advantage of telemedicine on a normal basis, and now all of them do. Because, hey, let's not take the risk if we don't have to. If I have the ability to get you treated with you staying in your house and me or the specialist staying in theirs, that's a better move at this time.
Right. Yeah, that's amazing. I'm thinking even with regard to, you were describing earlier, the old way of doing it, I suppose that's an okay way of saying it. The old way was to be in a sleep center with all these leads hooked to you and attempt to try to get sleep. And nowadays you can just put an oximeter on your finger and sleep at home. So that could probably be mailed to you as well.
Absolutely. Sleep labs, for the most part, are closed during the pandemic here. And listen, it's not being considered an essential business because it can be done at home. About 99% of our testing on a normal basis is done at home. We treat patients who do test positive. We bring them in labs for different reasons, not as much for diagnostic purposes. So if you already have sleep apnea and you want to get an oral appliance, you may or may not need to get retested. Either way, we would do it at your home now for sure and take you probably through the whole process while staying at your home, keeping you safe and hopefully keeping you alive.
Absolutely. Absolutely. So any pitfalls, I think we kind of just said that. I mean, as far as pitfalls and seeking treatment right now is different than normal.
Yeah, it is. And listen, we have to face facts. This is a different world today than it was. You know, literally a month ago, I was in Vegas giving a course about sleep apnea when the first talk of, wow, this is starting to rise here in the United States. And for the first time ever at a course, we weren't shaking hands with the people who were coming to our course. We were fist bumping or doing the elbow hello and being careful. So today is a different world. You do want to be careful. You do want to stay away from any of the risks. And done safely, there is no reason this to be anything but a positive in your life. You're going to call a specialist such as Serenity Sleep, have them take you through it, have yourself get tested at home, hopefully have you even get treated at home.
Absolutely. So we got about 30 seconds left, and we mentioned Serenity Sleep Solution. No, yes, it's serenitysleep.com. I want to make sure I get that right, serenitysleep.com. The phone number in Quincy is 217-214-7222, and the phone number in Keokuk is 319-313-8953. Again, that's serenitysleep.com. Doctor, thank you so much for being with us. It sure has been a pleasure to have you.
Laura, the pleasure was mine. And even if we can save one person out there, we did a good thing this morning. I appreciate you having me on.
Absolutely. Stay safe.
Thank you. You as well. Everyone stay at home and stay safe.